can start with the first presentation, and for each presentation, time of 4 minutes has been allotted. Okay.
Is it conversion of non-ischemic CRVO to an ischemic variant? The objective of this presentation is whether whether we can differentiate between conversion of non-ischemic to the ischemic variant from the recurrence of CRVO. Now it's a case of a 72-year-old housewife who presented to us with sudden onset diminution of vision since the same day morning. She was diabetic and hypertensive since past 20 years. The right eye, she had a visual acuity of 20 by 25 and she was pseudophakic. Now when we see the posterior segment of the eye, we can see that there is dilated tortuous veins with dark column of blood. What is more visible over here is we can see that there is presence of dot and blot hemorrhages that are all over the fundus. When we see closely at the posterior pole, there is presence of multiple superficial hemorrhages also. However, the OCT showed no macular edema, so at this visit the patient was advised to observe. The left eye also had presence of dry age-related macular degeneration changes. The left eye remained normal throughout the course of visit, so I'll be discussing the right eye in the subsequent slides. So we requested systemic investigations, in which we found that she had deranged serum homocysteine levels as well as elevated triglycerides. So at this moment of time, she had presented after 1 month. Here we can see that when we compare to the presentation, there is increase in the numbers of superficial hemorrhages that we are noted. The vision also has decreased, and the OCT, if we see over here, there is presence of macular edema that was not there before. So at this moment of time, we decided that we'll go ahead and inject intravitreal bevacizumab. Over the period of time, she did improve. She was lost to follow for 2 months. She came after third month. In the meantime, she underwent coronary angioplasty, which was 1 month prior. At this visit, we can, however, see that the superficial hemorrhages that were noted before are resolving, and the macular edema has resolved. Over the period of the next 9 months, she received multiple injections, and to our surprise, again at the 9th month follow-up, the visual acuity, which was maintaining somewhere close to 20 by 25 parts, had dropped to 20 by 100. Another thing which I'd like to draw your attention upon is the superficial hemorrhages that were resolving before have now again come back, and the macular edema had also come back. We did give an intravitreal injection again, but this brought us to a diagnostic dilemma that are we dealing, the number of hemorrhages have increased which were resolved before, the macular edema which was responding to our treatment has come back again. So whether are we dealing with a conversion of a non-ischemic variant of a CRVO to an ischemic variant, or there is a recurrence of non-ischemic CRVO. Now this brings me to the objective of my presentation, that can we differentiate this conversion of non-ischemic to ischemic variant from the recurrence of a CRVO? The answer is yes, we can. Now in literature it has been said that if we want to term a CRVO as a recurrent, there has to be a complete resolution of prior event of a retinal vein occlusion, and then there should be reappearance of signs of CRVO. Now, however, in our case, we had seen that the superficial hemorrhages did resolve, but not all the signs of CRVO had gone away. So this rules out a recurrent non-ischemic variant, recurrence of a CRVO in our patient. Now the next thought what we are left with, that either we are dealing with a patient who is non-ischemic to present with, and is he converting into ischemic variant. So in literature it has been known to show that the increasing in number of hemorrhages that are there over the course of periods and over the course of a treatment, this may be a sign of progression of a non-ischemic variant to an ischemic variant. So now let's come back to our case and gaze at the response of what we get after treatment. Over the course of time, we can see that those superficial hemorrhages as well as the dot and blot hemorrhages have resolved, are resolving over the course of time, and the macular edema is also resolving, and the visual acuity is coming back to 20 by 30. Now, if you see and traditionally describe clinical parameters to say it as an ischemic variant of CRVO, our case doesn't fit into the very same also. So it is neither a conversion of non-ischemic CRVO to an ischemic variant. It is neither a recurrent CRVO. So what it could be with this food for thought, that whether it is just a progression of thrombus, I would like to end my presentation.
A very, very good case to present, and you have highlighted the points very nicely. And if you go back to the original article written on vein occlusions by Dr. Sohan Singh Hare, it's a landmark article. It shows that around 18% of the patients of non-ischemic variety can get converted into ischemic variety. So if they are getting converted into ischemic variety, which means there is a progression of thrombus only. Occlusion is increasing, and it is getting converted into ischemic variety. And recurrence is, though not very common, but then it is seen sometimes. It's more commonly seen in branch occlusions, where you have occlusion of one of the branches, and later on another branch is getting occluded. So even recurrence is seen in quite a lot of cases. That is why just concentrating only on the macular status is as important as concentrating on the other parameters like homocysteine and lipid profile and the blood pressure, avoiding nocturnal depth. Things like that have to be taken care of, so as many of these patients don't progress. Apart from that, even intraocular pressure also is a very important factor in such cases.
So one thing, if we are suspecting that it is non-ischemic converting into the ischemic, we should have done angiography also to see the perfusion areas.
Yeah, I do agree on that, that we don't have an angiogram of this patient at this moment. But at that moment also, we did have it's a thought in retrospect actually, that we have couple of cases where we are seeing that the hemorrhage have gone and they do absolutely fine in the over course of 13 months, 24 months, and then again they have not